Every nation under the sun casts shadows. According to the Fistula Foundation, vesico-vaginal fistula, also known as VVF, is a maternal childbirth injury often seen in rural areas of Africa. It occurs when a woman is forced into prolonged labor because she doesn't have access to a C-section. This results in an abnormal opening between the bladder and the vagina that results in continuous drainage of urine. VVF leaves a woman incontinent, humiliated, and all too often shunned by her community. Surgery is the only cure.
My name is Dr. Jemimah Agyema. I am a consultant family physician. Particularly, I work in the VVF section, where I also provide care, surgical care to women who have been having urinary incontinence for years. And these are women who have been rejected by their families because of the smell that emanates from their body. They cannot have a social life. Some of them cannot even go to church. I know of a woman who gave a testimony that she sat on a bench in church, and then because of the urine that was dripping on her clothes just stained another person, and because of that the woman left. And anytime she get back to church, people leave the whole seats for her. And so you can imagine how that can affect her, how she can have psychosocial effect of that.
Dr. Agyema is an OBGYN physician working with the Jonah Inheritance at Bingham University Teaching Hospital. She is one of the few physicians in the whole continent of Africa who can perform this procedure. She learned this procedure several years ago when Dr. Carolyn Kirshner, an OBGYN in Chicago, taught her during a 2-week mission trip. After that 2-week exposure, Dr. Agyema developed the skills necessary to perform the procedure herself. Since she was already surgically trained, she had the foundation to build a skill set to help countless women. Since then, she performs about 250 procedures a year, bringing hope and healing to women in her community.
Hello, my name is Faith Gatto, and I had the opportunity to watch Dr. Agyema do 4 surgeries today. And I just have to say that, one, she's an amazing doctor. The work that she did today was very excellent work, and I think everyone who was operated on today is definitely going to be better. And so it was really cool to see how she fixed each and every one of those, because even though some of them, the diagnosis was the same, but how she had to go about treating it was a little bit different. A lot of the patients came from very rural areas, and so it is important, the support that we've gotten and hopefully continue to get. So I just want to say thank you for your support and prayers, and I just pray and hope that all of that continues.
Nigeria has the highest prevalence of VVF in the world, with between 400,000 and 800,000 women living with this condition, and 20,000 new cases occurring annually. 90% of the cases go untreated.
Some of them do not have any other source of support because the husbands divorce them. They find their way to our facility. These women have been able to provide surgical care, and after the surgery they have become dry, and those that have been abandoned by their families have provided form of rehabilitation for them and follow up. And they now have their families back. Some of them have remarried and have children. For me, personally, the Jonah Inheritance have equipped me. In fact, they have provided some resources, especially equipment for me to use. At least it's going to ease my work, like a mobile ultrasound. They've provided that, and some other materials that can help me to provide quality care to my patients during the surgeries. And so I'm so grateful that they're able to do that.
Moved by the tireless effort of Dr. Agyema and the resilience of the women she serves, the team rallies around her and aims to restore dignity to women shamed and isolated by society by no fault of their own. Every Tuesday, the clinic hosts a ceremony for women about to undergo VBF surgery. Previous patients encourage new patients, and our team member, Pastor Dre, gets the opportunity to speak.
And so God today wants to take away your shame. He wants you to know that just like these three have been healed, that you too will also be healed. What he does for one, he can do for another. Amen. So I woke up that morning and I wasn't really sure about what to expect. I knew I was going to a ceremony, but I didn't completely understand. And the first song, I put on some worship music, was about God taking away your shame. And I knew right then that whatever I prepared, put that to the side. And God wanted me to talk about that. And so because of the condition of the women, it reminded me of the woman with the issue of blood and how she had it for 12 years. But when she encountered Jesus, healing came forth. It confused me, to be honest, as women began to cry, right? And I didn't know what was happening. And one of the chaplains had to explain to me that the message was really touching their heart, and that's what they were experiencing. And so it just felt like a God move to me. And so God just wanted me to encourage them that in spite of however long, how many surgeries they may have had, because what I began to understand is they could have up to 5, 6 of those surgeries before healing took place, to encourage them that wherever they were in the process, that God sees them and he cares, and that one touch from him, right, can cause whatever is ailing them to be healed. It just hurt my heart to hear the struggle and the suffering, but also the hope that they were in a place where somebody was trying to help them be better and heal.